Good afternoon. And today we have a very special guest, Dr. Doug Thompson. And we're going to talk about hot topic, I think, about anti-aging and how dentists can contribute to that process. And I really like how Dr. Thompson said, his definition of anti-aging, how our biological age would coincide with our healthy age. That means what no one wants to spend years of the life in a hospital or under, multiple medications, managing different conditions and not to feel yourself. So we're going to talk about that. And thank you very much to our audience. If you have trouble sleeping and sleep next to the snoring partner, that's not healthy. And our program would be for you. What you can do to stay active and young and address your sleep as well as the other part of your health. And if you're a medical professional, this program definitely going to be for you because we're going to talk about collaboration of different areas of medicine and dentistry to make our patients healthier and make them live not only longer, but longer and fruitful years. So good afternoon, Dr. Thompson.
Thank you, Maria. I appreciate the kind introduction.
And I'm going to tell how we met. So we met at PANI. I mentioned my longtime friend, Dr. Stephen Lambert, many times, and his interview has a tremendous success. His book I constantly bring up on a lot of interviews. It's always on my shelf. And he introduced us, and upon his recommendation, he said, Dr. Thompson, he's doing something extremely interesting, and your audience would benefit from that. So here we are. I read all the articles Dr. Thompson wrote, and I'm going to give you short bio, but he'll give us more information on that. So he's a dentist, and he's been working many years in our field, and he looked very young. That's why I don't want to say how many years, but many decades, and he has tons of experience. And he's practicing in Bloomfield Hills, Michigan, not far from Detroit, and his practice called Integrative Oral Medicine. And he's part of COIS Education, which is number one dental continuing education school or university for dentists who are looking for more answers than just bread and butter fillings and cleanings, but who want to understand routes to roots. And his specialty, not specialty, but his area of interest, I want to say it again, it's personalized periodontal medicine, because he noticed over the years of his practice what patients usually come with a bouquet of a disease, and periodontal disease would be really part of that bouquet. So he did a lot of different courses, but I want to focus on a course that caught my attention. It is called Anti-Aging. And he published a lot in different journals, and he has a wonderful community of dentists called Wellness Dental Network. Basically, what just I said before, how dentists can contribute to the wellness, long-term health of their patients. And he has, he's leader of that community, and he's teaching, and he's also, his community not only local or national, but actually international. And he's trying to help patients not only in the United States, but also abroad. And we're going to talk about that, what he does. So please tell us, what inspired you to create Wellness Dental Network and Integrative Oral Medicine? I want, to give us that path of that revelation, what you find your mission that way, how you find your mission that way.
Yeah, thanks, Maria. The Wellness Dentistry Network was really a concept to share some of these cool ideas with my friends. And I started to think about what are the areas a dentist, like if I'm a dentist and you come in and you sit down on my chair, what are some of the areas where if I had some awareness about your health and what could make you healthier, what could I say to you that would maybe help you have a bigger interest in being healthy? And what could maybe extend your life, or what could make your life have more vitality and, you know, more longevity. And it all came down to trying to reduce inflammation, or we call that word now today for our professionals, oxidative stress, but inflammation. And there's lots of things. And, you know, Maria, it takes the right kind of nutrition, the right kind of sleep, yeah, exposure to no pollutants, the right kind of hydration, got to exercise. So these are some of the simple things that we can do to be a lot healthier. And if your dentist knows how to coach or guide you on some of those terms, you could become really valuable to a patient. And the reason why, Maria, is because we have FaceTime with patients, right? We have appointments that last longer. Physicians, the average physician has 5 or 6 minutes. So we have a lot of time. We want to use that time wisely. Wellness Dentistry Network helps dentists learn how to do that.
No, this is wonderful. And I think that's the really lifetime mission. And I wrote for a lot of magazines for, high profile publication. And I always specify that idea, what we have that unique role. Yes, we don't have a good reputation. That's on the other side of the coin. But really, we have a chance to develop a great relationship with the patient for the fact that our appointment lasts longer. And not only that, we also have a team who have a chance to spend time with the patient. So we have to kind of utilize both sides of that fortunate, unfortunate alliance, I would say. So
yeah, and before you go on, Maria, I just want to say that's why our hygiene team, and as a matter of fact, they're so important in my practice. I call them periodontal therapists. That's why our hygiene team is so important, because they're the connecting face with the patients.
Absolutely, absolutely. That's exactly how I think about, hygienists. They're not hygienists and they're not cleaning ladies. They're important liaison between the doctor and the patient, because they have
health therapists
to get that trust. But I'm going to go straight to your article. And that question was bugging me for days. We all know about bacteria in the mouth, but in your articles, you specify something what we all scared a lot: how oral bacteria contribute to cancer. Cancer in the different areas. I know you put it so well in your articles, and I want our audience know this path.
Yeah, the oral bacteria, if you have the wrong kind of bacteria in your mouth, they can release certain things that can trigger other mechanisms in the body that can make you more prone to cancer. And you talked about bacteria, Maria, but yeast can do this as well. So the idea is there's components of the mouth that are sometimes there in health in small quantities, very, very small quantities, that if they grow bigger or grow too much and they get too much of it, like too much of a good thing, then all of a sudden it can create a mechanism for cancer or for cancers to grow. And they can grow anywhere from the mouth to the stomach, to the colon, to the pancreas, to the prostate, to the rectum. I mean, this cancers all can come all through the body from exposure to the wrong kind of bacteria. They get out of balance in the mouth. That's why we tell people brush and floss your teeth. It's about getting rid of some of the bacterial load, like the amount of bacteria, if you keep it lower, and it's then it doesn't get a chance to become so pathogenic. So the cancer mechanism is very scientifically sophisticated, but let's just say it's exposure to the wrong kind of too much exposure to the wrong kind of bacteria that are in your mouth anyways, but in very small quantities. And when they get out of balance, that's when we have problems. That's why we measure them.
Yeah, I would like to ask you, how do we measure them? And who should measure those bacteria in the mouth?
Yeah, every single person should have some idea of what's going on inside their mouth. So I used to think that we would only measure diseased people. But now I think that it's really nice to know health or disease, because it's not so expensive, Maria. I mean, it could be, depending upon what kind of test you want, it could be under $400 or it can be under $200. You could get a test for even, $150 for some companies for some things. So let's just say it's not so expensive. We spend more on a gourmet meal than we do to find out if something in our mouth could be killing us. And so that's the idea. And these tests are simple swish and spit tests. They're either swish and spit tests or a collection of raw saliva. As a matter of fact, I think I mentioned to you that we created a company called Home Dental Exam, which allows people to go online and they can order the test over through the mail if they want. And they could get an analysis of their saliva, and we would send them a report with some recommendations. But people should know. You should use it as a screening tool to see what's going on, and especially if they have somebody else in the family that's sick.
No, I think that's so important. Yeah, we also, that I forgot to mention, when you talk about exclusive role of dentist, we also have a chance to see the generations of the same family and educate to prevent some catastrophic events for the future generation. Yes, I always mention that in the sleep, but it's the same thing with, other type of a disease, with
It's the same.
cardiovascular disease, of course.
Yeah, and the other thing that I see sometimes, Maria, is I see husbands and wives and even children in families that have the exact same bacteria profile. So in other words, we know there's some transmissibility issues. So if I'm struggling trying to get somebody well, the first thing I want to know is who is it that you might share saliva with, a partner or a spouse or a significant other. And we would want to make sure we know what's going on with that person as well. So we have a lot of husbands and wives that have very similar or almost exact bacteria profiles. And if they're pathogenic, if they're disease producing, then we would want to help them suppress that population so it's not so risky. Maria, we're up to 57 systemic diseases now from mouth bacteria.
Wow.
So 57 systemic diseases.
Can you give us an example? What would be the systemic diseases connected to that bacteria?
Yeah, cardiovascular disease, diabetes, leukemia, cancers, bone marrow problems, all kinds of osteoporosis, rheumatic arthritis. I mean, the list goes on and on and on. 57 different diseases. We now know that if you have an unhealthy mouth, you are not well somewhere. Something's happening.
100% agree, but sometimes it's hard to prove it to the patient, and I think saliva test can be great proof. So, okay, we talk about what bacteria and yeast and viruses, that combination, I would say that unhealthy or pathological colony can affect human body in such a detrimental way. So please tell me, what can we do? How can we help patients? What would be different scenarios for treatment?
Yeah, one of the things that we want to do is figure out a way to reduce the bacterial load, the abundance or the amount of bacteria, especially if they're pathogenic. And we do that through basically cleaning methodologies. In the dental office, we have some very cool professional instruments that will allow us to help clean the teeth, because the teeth are really hard surfaces to clean. I mean, they got lots of curves, they got lots of nooks and crannies. So sometimes we need specialized instruments. We also need to use what we call like antiseptics, right? People know what antiseptics are, but they would be very therapeutic rinses that we use for short term to help suppress the load. And sometimes, Maria, we even need antibiotics, but we only use antibiotics when we have a dentist managing that with them. I wouldn't be doing that on my own at home, but I would be using with dental guidance, we would use antibiotics. So what happens is it's debridement methodologies or bacterial reducing methodologies. Like, let's say if you want to clean in between your teeth, I already know that you can clean in between your teeth with a toothpick, but you can clean in between your teeth with dental floss. You can also use a water pick. And I can tell you one of them is going to be better than another one. So we typically use something like a water pick if you're diseased, oral irrigation, because then we can also put some medicines in the tank too, not just water, but we can add some medicines. So the idea is we help customize those methodologies that fit for the patient in their lifestyle, in their hands, in their environment, because not everybody's the same. They have different dexterity, the whole thing.
No, that's 100% true. But a lot of my patients come to me and say, I rinse with the Listerine. What's your relationship with the Listerine, and what other rinses you think would be the better choice?
Yeah, that's a nice, the whole thing about the rinse, I call it the rinse roundup, right? I mean, all these rinses that we have, the most potent rinses that we have are either chlorine or iodine based. These are the strongest rinses that we have. Most of these rinses are not available commercially. I mean, they're not available in the drugstore. Most of the drugstore rinses are essential oils, alcohol. They're different types, nano silver. They're different types of concoctions that we can get, and most of them will help, but they don't really have the killing power of some of the rinses that we can use professionally. So the biggest thing that a consumer should learn about rinses is how acidic are the rinses, how much acid do the rinses produce, because we don't want acidic rinses. And through our wellness dentistry network and even home dental exam, we teach patients about the acidity of rinses and the grittiness of certain toothpaste to make sure that patients are using products that aren't harmful, that there's products that are helpful. In Listerine, although it has some germ killing potential, Maria, it's very acidic. And so we don't want to use any of those acidic kind of products.
Yeah, I like in your articles how you talk about iodine rinses and chlorine rinses. Yes, it has to be a special dilution, but it has a basic pH, and I think that's critical. Now I want to ask you a very simple question. You know, as I'm a dentist who help people to sleep and breathe at the same time, you know, to treat sleep apnea or control sleep apnea, I notice what a lot of sleep apnea patients have periodontal disease in the mouth. But my question to you, that, you know, something I see all the time, I want to know how periodontal disease contribute to cardiovascular disease.
Yeah, that's a very nice question. And periodontal disease contributes in either the bad bacteria have an effect on the lining of our blood vessels. So it lets things in our blood vessels that shouldn't be in there, number one. Number two, it changes the muscles in the wall of the vessel and it makes our vessels stiffer. You know, we like to have vessels that are elastic. If your blood vessels are stiff, then your blood pressure goes up and they get more rigid, and that's not good. The other thing that happens is it changes our lipid profile. Now, lipids are things like you might know as cholesterol, or, you know, we have good and bad cholesterol, but these bacteria have an effect on the lipids. They also have an effect on platelet function, which are our blood platelets, that's clotting. And so they have an effect on that. They have a tremendous effect on cardiovascular disease from a scientific standpoint. And what I can tell you, Maria, in cardiovascular medicine, that's the first discipline that has said if you have the bad kind of and the wrong kind of bacteria in your mouth, it's causing changes in your blood vessel that's contributing to cardiovascular disease. So what's our job as dentists and dental hygienists, periodontal therapists? Our job is to make sure people don't have the stuff in their mouth that's contributing negatively to the disease process, and just take the mouth out of the equation. So the mouth isn't a contributor. That's
Yeah, no,
what
that's a fantastic words. And as a dentist, we work hard on that topic, but it's easier said than done because it's require a lot of discipline. So my question to you, what concerns me a lot, you know, I know with some pathologic bacteria in yeast and, you know, viruses, you use antibiotics, and you explain so well how it's not like, what about microbiome and antibiotic resistance?
Yeah, this is a dynamic question. And what most of the research finds in dentistry, we don't use a lot of antibiotics in dentistry. And where we get resistance from actually is our environment. We get bacteria in our food. They feed plants. We get antibiotics in our food. They feed plants antibiotics to help them grow better. So we're eating antibiotics, whether we know it or not. We're eating antibiotics, and we're getting exposed to antibiotics in a lot of different places than just our dental office or our medical office. So there was a very beautiful paper done around 2015. And this paper in antibiotic usage, Maria, showed that most of the resistant bacteria that are created or that are created in dentistry are transient, means they're only there for a short time, they go away. And the other thing is, many of the resistant bacteria that we think we created, we didn't create them. They were already there before we started giving the antibiotics. And what I would like to do is, I'm a proponent of very prudent use of antibiotics, so that I have patients that we treat their periodontal infection one time 15 years ago, they had antibiotics, no antibiotics. Ever again, just maintenance. And that's the way we want to try to treat patients. And if we can get away from antibiotics by using probiotics or other good things, or the patient can manage it on their own, I would prefer no antibiotics. So that's my idea. But there's no medicine person, Maria, in the world that would treat this sophisticated disease without using some antibiotics. It's a medical disease of the mouth with a dental solution. And
Yeah.
we as dentists have to take care of it.
Absolutely. Thank you very much. And I highly recommend to our audience to visit your website, Wellness Dentistry Network, and for medical professional, dental professional especially, and join the community. I think that's a new personalized approach towards health. You present a new personalized approach towards health. And thank you very much, Doctor, for your time and vast amount of knowledge.
You're welcome. I'm happy to do it anytime.